yes, I did just get adjusted, but even though we're providers, we still treat ourselves and everyone in this office the way we treat our patients, because that's how we believe, and that's what the research says is the best way to heal damaged and injured tissues. Hey guys, Dr. Tiffany here at Sioux Center Chiropractic, and I've got McKenna, and she is shockwaving me, and I thought this would be a really good time to talk about how our office is a little bit different. So, as I said on a previous video, I injured my back taking my children and all of their luggage on a extensive travel day, going to my brother's wedding. And I had seen a friend at church the next day, and I was in a hurry, and I said, oh, I have to go get adjusted. And she goes, oh, didn't you just get adjusted? I just saw your video. And I thought this was a really cool time to kind of go through how, yes, I did just get adjusted, but even though we're providers, we still treat ourselves and everyone in this office the way we treat our patients, because that's how we believe, and that's what the research says is the best way to heal damaged and injured tissues. So, no different than we would recommend for a patient who has a injury to their back. We also utilize treatment care plans for ourselves. So what that looks like is a trial of chiropractic adjustments with Shockwave. I just had radial, and I'm gonna actually have some focused here in a minute. And the tissue response to healing is the same whether I'm a provider, I'm a patient, I'm a kid, I'm an adult. You break your arm, the doctor's not gonna tell you it's better in a week. Due to certain factors. The tissue takes a certain amount of time. So in my back, there's muscle damage. Damage is a strong word. I injured my muscle, and with that, there's some ligamentous and other structural changes that we're working through, along with the rigidity caused by those in my spine. So the tissue response in me is not going to be a one adjustment and done, just like it's not a one adjustment and done with you when we treat you. The tissues take a certain amount of time to heal. So that's why we believe, and the research supports that belief, that we utilize treatment plans so we do not just cover it up. There is somebody down the street that will give you a quick adjustment, band-aid your pain, because chiropractic works. The pain gets better with the adjustment, but the tissues still take a certain amount of time to heal. And that's not person dependent or practitioner dependent. That's based on what the research and literature tells us, and that's how we create treatment plans. So I thought that was a cool opportunity for me to say, just like that patient and that friend at church who gets adjusted here, I'm also on a treatment plan for my back pain. That is an injury and will take some time, even though the pain gets better quickly. So that's my talk with the doc. I hope that answers some questions and some clarity that we treat ourselves just the way we treat you, and that's evidence-based, based on tissue healing response.